morning. Welcome to the New Rochelle listening session for healthcare.
My Mother's Keeper has been called a cradle to career initiative since it focuses on children and young adults from birth to age 24. It aims to lift all children, but particularly boys and young men of color.
So one of the big problems that we have in Westchester and throughout the United States has to do with chronic disease. And this program, you'll see this flyer outside, will be launching both in Yonkers and in Peekskill, and there's a phone number to call. So if enough people, we just need to get a group of people locally here, then there'll be more programs launching. But it's basically a year-long program that provides support and help people avoid diabetes and make small changes that can lead to lasting improvements in their health. As well, there's another concern that's been going on for a few years here throughout Westchester and the country, and that has to do with opiates. Many police officers throughout the county have been trained to administer Narcan, which is the antidote to an opiate overdose. So many people have contacted the health department and have attended trainings. We've trained healthcare workers, we've trained community residents, we've trained family members who have, someone in their family who's battling with addiction.
So, to start our conversation on aging and elder care,
my concern is that we hear healthcare providers, insurance companies say that we're really patient-centered and the patient is really our number one. But in my experience, that's not what I'm seeing. I've seen seniors that when they go to, let's say they go to a doctor, they're bounced around. Well, now you have to go to another doctor and then another specialist, and they're bounced around, and it may not always be in the same place. So they're going from, let's say, like from one location to another location. A lot of them don't drive. So now we have the problem of transportation. How do we transport now these seniors to these doctor visits? And what happens is they get so frustrated that they don't go to the doctor, and they're not getting the care. And I think that's really a frustration. I mean, at one time, you had doctors that did home visits, and I'd like to see more of that. But hospitals discharging people home, that's not a safe discharge. They're going home, too early. And again, that's my own opinion, but when they're going back into the hospital 2 or 3 weeks later, something's wrong. Okay.
Yep. And Montefiore happens to lead the PPS in the Hudson Valley. So we are really taking ownership of how we bring access to care outside of the traditional clinical setting and make it accessible to the everyday person. And I think that's the direction that healthcare is moving in general.
So my neighbors who live alone, who are seniors, and I'm almost a senior myself, I think you need to have an independent medical advocate for the senior citizen. And what I mean by that is you need a professional person who understands the medical jargon and has nothing to do with the hospital, has nothing to do with insurance, who can advocate for that specific person and explain to them what their care is, what that means, whether it's 2 times, whether it's 10 times, whether it's 50 times, so that they understand what is the post-hospital care, what is their home care, creating connections between social services. And a lot of people that live in Westchester don't qualify for Medicaid or whatever the other local services are. So how do they negotiate the system? How does it, if they live by themselves and their children live out of state, what are they supposed to do? So I think that they need some independent advocate that is not paid by the healthcare system.
2 years ago, I was going blind, and I said, oh, okay, this is great. You're blind, you're about ready to fall down the stairs and kill yourself. I went to Manhattan Eye and Ear, New York Eye and Ear Infirmary, Lincoln Hospital. They all laughed in my face at the idea of the temerity of a poor person coming in asking for care okay, I'm not discouraged, it's a great big city. I went to Montefiore. I went 3 times to the eye clinic. I figured I'll wait till they throw me out with the trash, you know. And got an appointment with a wonderful doctor there who said, you know, you are exactly a candidate for laser surgery. So long story short, I got one of the top 5 specialists in the city. One of my heroes, Dr. Jimmy Lee, who did the surgery on both eyes 2 years ago. I went from $2,300 to $2,030, and I did not pay a nickel. So that was a happy story, but you understand, this took roaming the streets like a crazed animal, all my legal experience, all my experience with medical professionals, everything to get any service. How many people are roaming around blind or in need of heart care or anything else because they cannot navigate the system? It's so bad.
So this goes
In terms of children with disabilities, what I see as an educator here in New Rochelle, as I work with children and families, there are students in the school system with disabilities who I'm noticing across the city that on their birthdays, it doesn't seem as if they have birthday parties. There are families that are not getting, I don't see them having access to opportunities for social engagement that may give their kids, the parents and their kids, something to really augment their development. And it's not just happening with one child or 2. I'm seeing it as a tutor privately in many homes.
Perhaps, going down the line, this is another opportunity for United Way's 211 to increase the information that we have on our database. And we have, people help me here, how many hundreds, how many thousands of services on our database? And this is perhaps a different kind of information that we could collect so that there is one central point that the residents of Westchester can call and get information about this. So,
as you get older, you know, maybe this is a concern maybe younger people don't sense, but I've sensed a disrespect for life, which is a health question. As you get older, you know, this is not a topic that's new, but I think more present now than it's ever been, that I don't know whether the politicians or the people with money who pay for health care actually believe it's important to keep old people alive anymore. And whether it's legislation in Albany or just talk about allocation of resources. When you get old and somebody's talking to you, as some of you folks have, about do you have access? Well, you may have access, but they might not want to provide it to you. And that, as I'm getting older, I'm wondering about that. You know, is somebody going to say to me when I'm a little older, well, geez, Mr. Malfitano, you know, that cancer treatment, that costs a lot of money for the state of New York, and, you know, maybe there's some other things you might want to think about. When I go to the doctor and he said, well, your health plan doesn't pay for an x-ray of your knees, it'll pay for an x-ray of your chest. But it's my knees that hurt. Well, I can't afford it. So I, you know, as an older person who's worked his whole life, sometimes I say, you know, with all due respect to people who don't have, maybe I'd be better off on Medicaid, where I don't have to worry about co-pays. I don't have to worry about paying for my medical care or paying for my... So as you get older and you've tried to make a plan for your life, to hear people in the body politic having discussions that almost encourage you to choose to die.
But then they're on the other side of the coin where I've heard people say that that's their preference, that they don't want to have the treatment. So I think everyone needs to be educated and they have to ask questions, what are the options? Yeah, and I think we should really be concentrating on preventive alternatives.
And I just want to add to that also, there are a lot of support groups out there. You know, that in fact there are some, like, I think they're called At Home, At the Sound.
Yes.
And they are people that are volunteering their time and also fundraising in order to become a support system for people that are aging in place and also that may encounter challenges with health.
Diane has a question.
Diana?
I'm here. This lady had a.
I didn't have a question. If you don't mind, can I run through this list? Because I think there's a lot of things you're missing. The cost of healthcare, it's very difficult for a person on Medicare to figure out should they have supplemental insurance or not. Because when my mother was alive, she was paying more for the supplemental insurance than she would have been paying for her copays. But the only way she could know that is if I laid it all out on a spreadsheet, because it's sheet by sheet. So there's not, like, when you have regular insurance, it'll tell you how close you are to your copay. The total amount of copays. So you can't make an informed decision about should you have supplemental insurance or not. Do you understand what I'm trying to say?
Yeah.
Okay. A lot of seniors can't cook for themselves and they don't want Meals on Wheels. So they need to eat healthy and maybe they can't cook for themselves because it's too much to think about. Maybe they have mobility problems. Their apartment isn't set up that way, whatever the issue may be, and they want to stay where they are. What do you do for that senior? Mobility issues with stairs. There are a lot of old buildings in New Rochelle, and I'm assuming they're grandfathered out from, is it the ADA? From the ADA. So you have seniors living in walk-ups who have to walk up and down the stairs. Now, if you have knee replacement surgery, I mean, how are you supposed to get up and down the stairs every day? So that might impede your ability to be social. Also, in the downtown, they removed all the benches. So if you're a senior that walks to the center of town to shop, and you need to sit on the way back, there's nowhere for you to sit.
That's a good point, that's right.
There's also limited care. So if you've used your 30 days of physical therapy, but you need 60, you're SOL. You can't move around. The power of attorney. I think that a lot of seniors don't understand that, nor do their children. Like, they throw all this stuff at you and ask you to read it before surgery, but I think your mindset isn't there because you're more concerned about the patient.
She's talking about a DNR.
Is that?
Support for dying. If there's no going back, that could be for anybody though, but if there's nothing really that can be done, how do you support someone like that in their community? Can they die at home? Do they have to die in a hospital?
About navigating the healthcare system, I wanted to mention that Westchester County does have health navigators that are very helpful to residents to analyze their individual needs, both for insurance and to even they work one-on-one with residents. For example, someone has a doctor that they'd like to continue a relationship with, and they need to know, well, if I change health plans, will I be able to see this doctor? What are the costs going to be? All those kinds of things. So by contacting a health navigator, residents are able to make an appointment either over the phone or in person, and I've seen people come out of those sessions so happy to, and relieved.
Health navigators, bilingual or trilingual,
Yes.
that is important to know.
Yes.
And
I can say easily, there were 100,000 contacts via email for this particular event. And there are less than 100 of us in this room, showing that we have a less than 1% impact rate. Now, there is a range of reasons for that, none of which is quote unquote anyone's fault. But at the same time, if tomorrow you asked any given resident, did people come together to talk about what was important in the community? They may have no idea that this happened. And so we have to continue this work of trying to educate beyond the individual events. Because again, I could go and speak to my next door neighbor who is a senior advocate. And she's going to be like, you know what, we need to put together a meeting to talk about what's happening with seniors, or talk about what's happening with youth. And I was like, yeah, I was at one yesterday. I didn't know about it. I'm like, really? Like, I put a flyer in your car. So, as we're talking about ways in which we can continue to get this message out and to do that education, understanding the limitations and the fiscal challenges of both large organizations and individual community members, it still becomes important for us to rely on those individual networks, that if you're coming, bring one person with you, because otherwise, 5 years from now, we're going to continue to have this argument. I've been doing this work since '88, and it's sort of the same discussion where it's like, well, people don't know, well, people don't care. And no, people want to know, people want to care. People want to have access to all of those services that you were listening and describing, Sharon. But at the same point, we're all busy, and so how do we then do that individual education? How do we inform ourselves across the spectrum of topics so that we can become, in many ways, expert on them, and then continue to inform our communities?
I work for United Way, so I'll put a shameless plug in for 211, because I think it's an amazing resource. And another resource that the community just is not that aware of, despite constant reinforcement. But 211 has these kinds of answers.
Frequently, I spend lots of time up at the county health department going, tell me about all the wonderful things that are going on here, because we don't know about them. Each one of us has an expertise. What becomes important for us to do is to know who the other people in our network are, so that when the question comes to us, if we can't answer it, then we know who to direct them to.
And another suggestion I might make is, why don't you pair seniors with some young person who could teach them how to use the phone and get access to the computer? I mean, we do have classes at the library and things like that, but why not have a one-on-one with that's also social. And they teach the senior citizen how to use their phone, how to use their television, how to access this information that they don't understand.
also there's community health centers that have taken up on themselves to organize working groups. We have mothers groups, women's group, men's groups, youth groups, name it. And they have linked the youth centers. They go to these meetings and they gather together. They help the seniors, and they link the seniors with the youth. They have a seniors prom dance, and all these little things that gather people and help people to become part of the community. And if there is, out of all agencies and organizations in the county, if someone has an issue with the seniors or a youth or any issue related to anything, it could be lack of health insurance or issue with health, or a parent that can register their children because anything, transportation. The agencies within these collaboratives reach out to the network by email like have this family or this parent or this senior in this location with this issue. So those agencies and organizations and volunteers in that specific area reach out to the person. Each group, we have a program in Raglan County, in Peekskill, and Yonkers, and in Poughkeepsie. And these are people that come, they work, they have their lives, but they become volunteers of Hudson River Healthcare, and they bring those issues and problems from the community to the health center, and we try to work it out, and we empower them and train them to be able to help people in the community, or they always have a support from providers and outreach workers and patient navigators from the health centers. So, I'm sorry I took so long.
Okay, got something on your mind, say what it is.
One of the things that I'd like to share, my mom lived in New Rochelle for the past almost 40 years. And as she grew older and more frail, there were issues in terms of transportation to the services. She never drove. Also, therefore, that meant that she had to rely on family members to have her get access to service. And most of the services and that she used, particularly as it relates to health, they were only open from 9 to 5. So that meant that a family member had to take a day off from work in order to take my mom to take it to the healthcare facility or the doctor, etc.
We're in a paper bag or cup society where it's just easier to pick up food from the supermarket or a fast food chain because our lives are so filled with other activities, and to feed our children subservient foods because it's just easier, faster, and probably cheaper. The other part of the medication issue is I've seen the tiers of medication. You go to a doctor, they may give you samples that a pharmaceutical company gives them, and you go to the pharmacy and you may have a voucher that will give you a couple refills for less money, to find out after you've been on the medication for a couple months that your insurance company will not pay for it, and out of pocket you are having to spend $250. The other problem is the tiers. You know, when you speak to your staff or some of your people that work in your agency, some of the insurance companies have tiered medications. So if your medication is on tier 1, they either don't cover it or it costs you a lot of money. So people aren't going to afford it. They can't afford it. It's either give me the medication or I will not eat or feed my family that day. So I think the whole pharmaceutical overhaul has to occur in this country, and people may be more compliant with their medications.
You know, the appointments are like so far down the road that, you know, you go when you need the doctor, but, you know, if the appointment is 2 months down the road, you know, you might not need the doctor when you have it. You know, so is it something wrong with that picture? I mean, is it something that better that can be done? Now in this day of technology, you know, can we have a, you know, I don't know, a Skype or you know, virtual conversation with the doctor? You know, so
the thing that we don't think about, which is I think we as a community or community have to get back to, is putting some ownership on individuals like my mother. I've pressed this to her before. You know, I've said to her, you know, you need to get out of the house, get out of your comfort zone, and get out and teach some other seniors, get out and reach some other people your age. A lot of us are privileged, and this is what I was trying to say before, is that in these neighborhoods, you have individuals and groups with these resources and information. And I'm hearing and seeing that we need to, all of us, get individuals like my mother and other people in these areas who have personal expertise. You said it yourself. If you're not aware of of health opportunities and situations. If you know that you have health insurance, you know that you have situations if you get sick, but you're not really doing it because you're comfortable, you're complacent. Nobody's calling you, you're not calling anybody else, you're just doing your thing. And that's part of the dangers that are hitting every facet on education, on all of these areas. Taking charge, it says taking charge of your health. I think one of the solutions, and I'm going to take all this home this afternoon, and I'm going to present it to her. And she represents many senior citizens of all backgrounds here in New Rochelle who have all this wonderful knowledge. I mean, you know, and get these individuals, however small it is, to have a little group. Have a little senior, have an invite, or go out to a group and have a group of 20 people and encourage people to not be so afraid of finding out. Get involved.
And the solution will be like having a local health services right there in town or in the city, sort of like to alleviate part of that, a little bit of transportation, a little bit of access to health care.
In addition to that, I want to point out that easy access, a lot of the CVS now have urgent care. So, CVS pharmacies, and they have,
their sliding scale,
and
they see everybody regardless of health insurance.
Well, I'm not quite sure about the payment part, but what I'm saying is that you see more and more that they are adding to their services the urgent care. And I think that is very important because like weekends or late nights.
Another issue that I have, and I don't think we talked about, is people with disabilities. Because my daughter she's in college, thank God, but she's going to age out. And if she can't find a job with decent insurance, how is she going to pay for her underlying care without us? Then the other thing becomes, when you have you have a patient with a mental disability or even a processing issue, how are they going to be able to articulate what the problem is, what they need and what they don't need when they come and see a physician? Now, one really important thing that I'd like to point out: schools don't diagnose, okay? So if you say your kid has a disability, they're going to assess the child based on what they can do and what the school thinks the supports that they need, okay? And they will tell you they don't diagnose. So what does that mean? That means legally they can only provide research-based support based on whatever diagnosis that you give them. And so where does that diagnosis come from? That comes from a medical professional that more than likely is not covered by insurance. And they're expensive. And you either come out of your pocket with the money or you don't get it, and then it's like a trickle down. So I can't, one last thing. The other problem with access is that a lot of the physicians on my list, they're in the Bronx. I live in New Rochelle. Pay insurance, how come you don't cover these physicians in New Rochelle? Some of them they do, but if it's a specialty thing, I have to go out. I have to go out of, either I have to go to the Bronx, Manhattan, or far north of here. So that's a huge issue.
To remind everyone that Westchester County can be a resource for you because the county administers and provides, administers services for children from birth to age 5. So, coordinates evaluations and services, as well as transportation for children, toddlers who are diagnosed and are, then attend programs. The county facilitates that. In fact, 3/4 of the health department's budget is devoted to children with special needs.